let me give, it's quite a short presentation on how we engage with patients, and it'd be interesting actually to see if any of you change your thoughts following my presentation. So let me share my screen. There we are. Can you see that? Yeah, is that good? Okay. So I mean, it's been a journey, and I'll show you in a moment, but today really patient engagement or input of patients and gathering their voice is kind of everyday part of our work nowadays. It's systematic. Patients are involved in various areas, and it's, you know, nothing unusual anymore. Of course, we need to still enhance, but it's pretty much just saying that it's an integrated part of our everyday work. And here, this is really just, I won't go through all of them, but it's just showing that, you know, this didn't happen overnight, that, you know, when the agency opened, we had some initial dialogue with a few groups of patients, and then we set up a working group with them. Then legislation allowed them to be members of some of the committees, so full voting members. And then we developed a framework of interaction, which is adopted by our management board. And then we have our PCWP, which is the Patients and Consumers Working Party. Then in 2014, we had a department on public engagement, which was established exactly for this. And then we carried on developing for public hearings and involving young people as well, to kind of systematic involvement. And here I was just going to highlight that even though we had some dialogue in 2017, really, we developed what we call these principles on engaging with young people. Which was really the legal basis as well, that we could invite and involve those under 18 as well, which was important just to make sure that we could really hear everybody's perspectives. This is also just another graphic, and excuse all the acronyms, but this is really just to show, as I mentioned, that there are opportunities along what we call the medicine's life cycle, where patients and carers and consumers can get involved. And you can see there's a pre-submission phase here early on. Now, there are various activities. You've heard about the pediatric investigation plan, but there is also scientific advice, where companies come in and ask for advice on their development plan. And then there's the whole orphan designation, etc., for rare diseases. These down here are just the names of all of the committees. And here you can see, obviously, this is the sign saying where patients are involved. During the evaluation of the medicine, and then through onto post-authorization as well. We keep involving them when we're looking at the safety monitoring. And up here, this really just shows where they're involved in also not just coming in and getting involved in the assessments, but also in all of the written documents that we prepare, because all of this information, we need to make sure that we share this out there, but also we need to make sure that we write it in a way that is clear and understandable for everybody to be able to understand it, and that includes young people as well. So it's important that we get reviews of those documents there. So there are different ways that patients get involved in the activities. And here I'd more talk about representation, because people often say when patients come in, well, who are they representing exactly? And I think it also depends what kind of activity they're coming in to get involved in. But so, for example, when they are members of our committees and our management board, they come in representing the whole community. Now, of course, they can't know every disease area, but they come in and they bring up aspects from the patient perspective which might not have been considered, and then they also highlight times when it's needed to then call upon those patients with specific experience in that particular area. So it's a kind of community representation. And then other areas like our working party I mentioned, or if EMA is having, you know, these consultations, but not particularly about one medicine, but about general things, or workshops, that then we would invite patients to come in, and they'd be rather coming in on behalf of their patient organization. And so they would be representing the views of that organization, and the organizations that are involved with us are always ones that are representing Europe. So they're European patient organizations. And so that's where they are really an organization representation. And then we also have patients who come in as individual experts. And that's when most of the time when we're talking about the medicines evaluation. And so there are various procedures that they can get involved in. We share all the information with them because it's confidential, and for that reason we can only involve those patients as individuals. So obviously we try and involve those who have experience of whatever we're discussing, but they then give their own views and opinions. They very often bring in also the views and opinions of all their patient community, simply because nowadays we have so much better communication with social media and everything, that most patients coming in have a lot of contact, and so they can also say, well, look, you know, I can say this is not just my view, it's also the view of the others that I talk with. So it was highlighted a bit before as well, but I just thought it'd be to go a little bit into more detail of exactly engagement with EMA. So if young people want to get involved, or we ask for young people to be involved, well, what does that actually mean in practice? So here are some of the ways that we do involve them. So the first one is the early on scientific advice procedures. So this is when the companies have come to EMA asking for advice about the development plan. So often it's about their protocol, their clinical trial design, or it might be some of the things that they're deciding to look at, what kind of endpoints or treatment outcomes they're including, which patient population are they including or excluding, feasibility, all of these kind of things. And this, if it lends for patient input, we then involve patients. And when I say if it lends for input, sometimes the discussions are very technical. They might be about manufacturing or quality of the product. That really doesn't lend for a patient input. It's really when it's talking about clinical aspects. So then they would either come to a meeting if there is one, or they would provide their feedback in writing. So obviously we share with them the proposals and our proposed responses, and then they let us know what they think. Then also within the committees, so this is when a medicine is being evaluated. Sometimes the committees, usually the CHMP, the main committee, or it could also be the safety committee, will convene what we call an expert group meeting. They're often called SAG meetings, and we involve patients systematically to these. Like it's a part of what we do, and we always have at least 2 patients, and sometimes we have more depending on what the topic is. And they come into these meetings. They're very small meetings, probably 15, 20 people. And the aim is, they last probably about 4 hours. And the aim is really to have in-depth discussions about the issues or the benefit risk discussions that the committee is having. So the committee doesn't convene these meetings for every evaluation. They do it really where they feel there are some issues with the data that the company's given them in terms of weighing up those benefits versus the potential risks. And so it's very important that they hear not only from the specialists, but also from patient representatives. What do you feel then about this data that we've got? Maybe it's limited efficacy, but there are some safety issues or not. So that's where we have these in-depth discussions. Sometimes we don't have time to convene one of these expert meetings, but still the committee wants to hear from patients. So then we'll do what we call a direct consultation. And this is when the committee will draft some questions that they want to hear from the patient community. And then we send those out again via our network of patient organizations. And they will then share them out with a specific timeline. We collect the responses, prepare a report, and then that goes back to the committee. And these kind of inputs are shared with all committee members, not just the lead assessors that we call the rapporteurs. Other times we'll also hold a stakeholder meeting. The difference between a stakeholder meeting and an expert meeting is really that a stakeholder meeting is larger and we will have all the stakeholders. So for example, we will also sometimes have the pharmaceutical companies there and the specialists, the EMA staff, patient representatives, and quite often we do these in the safety PRAC, the Pharmacovigilance Committee, because often this is where there's already a medicine out there and there's been some risks identified, and we need to maybe see how can we better raise awareness of these risks. So we look at, you know, educational materials, things like this. Anyway, it's a great forum as well, smaller than larger than the expert group meetings, but not as big as public hearings. So you can see here as well, the last few years we've implemented public hearings, and again this is a forum where we can listen to everybody who's affected in terms of all stakeholders, and they are broadcast live, and obviously we can have a lot more people involved, and then people come up and they testify in front of the PRAC, the committee, and give their input. And the 2 that we've had were really instrumental in then determining the outcomes that we had for this ongoing procedures. So in order to make all of this work, you can imagine that I think on the two hands, you have to have various ways of engaging with patients. And I think we've seen some of them in terms of, do they come into a meeting, we have a face-to-face discussion, do we not have time, or do we want to get from more patients, we'll do it in writing. You might come to the plenary meeting. We also invite patients to the what we call oral explanations at CHMP. When the company's coming in front of the committee, patients also come in. Or we might do surveys, or we might even go a bit more scientific and do a patient preference study, which is where we ask people to rank their preferences in terms of benefits and risks, and this really comes up with some quantitative data. But for all of that to happen, so you've got the engagement methodologies we can choose depending on a case by case, but the more important is that we support and prepare the patients to get involved properly, because you can imagine most people, if you plop them in the middle of this committee or send them all this jargon, they're not really going to be able to contribute very well if they haven't had a lot of previous experience. So it's obviously up to us to make sure that we can brief and support everyone properly. And so equally, as you have different methodologies to engage, you have to have different ways for people to learn. So we do an annual training day. Unfortunately, the last few years, it's been rather tricky and we have to do it online. We have information sheets on our website. We have videos like voiceover slides as well, so you can watch it at your own pace. We have dedicated web pages. And then when the patients come in, most of the time we also have one-to-one support. So we'll send them the documents, we tell them which parts to read in these rather complicated documents, and then we give them a call and we run through it with them. We explain how the meeting will run, what is their role, what's expected of them as well, because often they say to me, well, it all looks very scientific. What are you expecting of me? What are the people there going to expect of me? And it's important for us to let them know that their role is to bring in those patient aspects, the things that we don't already have from the clinical trial data. You know, it's the things that you know much better about than we do, those day-to-day aspects. So it's important that they are clear about that. And obviously we make sure that the assessors and everyone else in the room is also aware of the role of everyone. So I mentioned about the networks, and again, if it wasn't for the networks and the patient organizations, we would never be able to have as much engagement as we do, because we just wouldn't have that outreach that we do. So, you know, it's thanks to them. And so any organization who's in Europe can register with us to be what we call an EMA eligible organization. There's some criteria they need to meet, which just helps us to understand that really they are dedicated to patients, that it's a non-for-profit, that, you know, they have the right setup, etc. And even if they receive funding, that's fine, but there's just certain parameters around that as well. We also found that we should open up to individuals as well. So you can see here, and I can also send you the link. Individual patients, carers, consumers can also register in a database that we have, and they can let us know what experience they have, what they're interested to be involved in, or purely if they would just like to receive information from us, like in a particular area, then we can send you the latest information coming up in that therapeutic area. So if there's a new medicine being authorized, or if there's a new safety issue. So it's up to you to let us know in that form how and when you would like to be involved. And of course, you can update it at any time. I'm just going to briefly touch as well on this, because it's something that often comes up when patients want to get involved, or, you know, there's the question on, well, I'm also being asked to be involved with the pharmaceutical company. Does that make a difference in terms of how I'm going to be able to be involved in EMA? And of course, yes, it does make a difference. So EMA has an obligation to make sure that all of its experts, and this is including staff, including any, you know, healthcare professional, patient, anyone, is the same way, that we have to make sure that there's nothing that could affect their impartiality, that they haven't been given other information in another way. So we have this policy on what we call handling competing interests. And really this just means that everybody who wants to get involved in product related activities, they would have to do what we call a declaration of interest, so a DOI. And here you just tick if you have been involved with a pharmaceutical company, if you have shares with a company, if your family does, all these kind of things. I'll show you the form in a moment. And then also to give us a CV. For patient representatives, you can just tick, I am a patient representative. We don't need to know anymore unless you want to share it. And then there's an expert nomination form, which just means then you'll be in our expert database, and then this is published. It lasts for 1 year, so you only have to do it once a year. It is a bit of a pain because I'm making it sound easy, but you submit it, you have to wait for your password, you have to go back, you have to validate, and unfortunately, it doesn't always work 100%, but I have a great team working with me, and we're also always here to help you with your form if it's not working. It also includes a confidentiality agreement, so that in this way we're able to share then all of this confidential information that obviously the committee is discussing. And I mentioned that it's published. So this is the form, one page of the form. It really is a series of tick boxes, unless of course you have had some interactions or some things, then it will just ask you for a bit more information. It will ask you, when did it take place? Because that also makes a difference as to whether you can get involved or not, and in which kind of aspect. A key one tends to be consultancy, because for us, consultancy means whenever you talk to a company really in a private environment. Of course, if you go to a conference and you're chatting to the company there, that's not a problem. But if the pharmaceutical company approaches you and asks you for a one-to-one meeting, or even 10 of you in a one-to-one meeting, this is what we would say you're giving expert advice to the company, and then this has to go on your declaration of interest, and then depending on what activity you would do at EMA, it could limit or even stop you being involved. It depends when it was, and it depends on the activity. And it doesn't matter whether or not you were paid for that activity, and it doesn't matter also what you were discussing, which I know sounds quite harsh, but I think you have to think that the EMA has thousands and thousands of experts involved all the time, and it would just be impossible for us to evaluate each one in terms of what was said in what meeting. Does that constitute a conflict or not? So it's literally any one-to-one closed environment, private invitation. The other one as well is just grant, because some of you obviously are members of organizations. So this is also to say that, you know, it's fine if your organization receives funding from a pharmaceutical company or companies. You can include it for transparency, but it doesn't make a difference. Employees do have to include it if they're employed by their organization, but again, it doesn't make any difference to involvement. It's purely for transparency purposes. So just going to finish off with some other kind of tangible examples of the kind of areas that we've involved young people, because obviously since we've had our principles document, we've been trying to involve younger people, and I think we haven't done it enough yet. So it's really about getting the committees, you know, to involve young people as well. And obviously the PDCO is the one that is doing it the most, obviously. So here you can see, and these were, most of them apart from the bottom, was interactions in writing. So for example, there was a product we were looking at for alopecia in hair loss, and but there were some slight risks with taking it, and so we really wanted to reach out to young people and say, you know, would you be willing to have this medicine? You know, how does it compare to other treatments that you have, and also bearing in mind this potential side effect that you might have. So we got responses from 15 different countries, which I think again shows how we can reach out across Europe. Another one was on contraceptives, and this was a new contraceptives which was looking at a very kind of different dosing option, much longer space between taking them. So we wanted to know from young girls how they felt about that. Did they think it would help them remember to take it, or would they be more likely to forget to take it, and other aspects as well. Another rare disease, AADC, also we wanted to understand from patients directly and carers what they felt about the proposed improvements, again compared to the risks. And then a couple of face-to-face ones were in haemophilia. We had a young boy who joined with his father to a scientific advice meeting, and he was really able to share his personal views on dosing and changing over between medicines, and how he thinks that would happen, and how he thinks it should happen, which was very useful for those in the meeting. And the last couple were ALS and EB, again, where the comp a while ago invited young patients to the plenary meeting to share their experiences in terms of the day-to-day burden. And so really then the committee gets a better understanding of what it's like and what limited other options are there. So to wrap up, why is patient engagement important? I mean, from the regulator's point, from EMA's point of view, we found that it's a way of bringing in those everyday aspects of living with a condition that we don't really get within the clinical trial data usually, unless obviously they've been gathering patient information. So it means that we can bridge that gap between the clinical trial data and what's actually happening out there. And also it means that our outcomes can be more meaningful and more relevant for you, which in the end of the day means you're more likely to take those medicines. I think as well, it also increases awareness and understanding and hopefully trust as well, because by bringing you in and sharing all of the information with you, we don't hold back anything with those who get involved. Even if the outcomes might not be what they had hoped for, at least they can understand why the committee took that decision and what a sometimes difficult decision it is when a committee has to look at those benefits and those risks and come up with the right balance. And then I would just say, for you engaging, you need to make sure that it's beneficial for everyone. So we need to come away with that information we can use from you, but you also need to walk away with learning something as well, and feel that it was beneficial for you. And that's why when you are engaging with anyone, I think you need to work together and work out what is the best way to get engaged. You know, some people prefer face-to-face, some people prefer just giving their comments in writing, some people prefer learning about things in a different way. And so I would say also as well, be prepared, don't hesitate to ask questions so you really know what is your expected role, and then try and look at the focus of whatever activity you're in and provide information that is relevant for that. You know, like at EMA, we don't get involved in pricing and cost, for example. So I always say to the patients coming in, obviously it must be hard for you if in your country this product may not be reimbursed or it might not be available, but EMA doesn't have a say on that. So better that you give us information that we can actually use. So everyone has a role to play to make sure it happens. And at the end of the day, we all come up with better outcomes. And that's it. Thank you.